I'm Jess, one of the practice nurses. I'm just sat here today talking to Dr. Skellen about how we will be managing our long-term condition reviews.
Hi.
So what is the current situation with regard to managing patients and long-term condition reviews?
Well, firstly, we'd just like to say a big thank you to all our patients for bearing with us over the last few months. Obviously, it's been a tough time for all. Obviously, due to social distancing measures, we haven't been able to bring patients down for their long-term condition review over the last few months, which has obviously led to a bit of a backlog of people who have missed out. So now we really need to try and catch up as best as we can and get those patients to have their long-term condition reviews.
Okay, so how do you intend on managing the situation?
Okay, so at Bridport Medical Centre we've been quite good in embracing technologies over the last year. We've been using e-consultations a lot and other new systems such as AccuRx, which allows us to do text messaging and video telephone calls and such things as that. The next step was to look at how we could use digital technologies to try and get people to have their long-term condition reviews without necessarily needing to come to the surgery.
And what would the digital solution look like?
So there are a lot of different providers. I think the partners here looked at 7 different providers of the technologies that we could use. There was one clear winner called MedLink. It was designed by GPs for GPs. It seemed really easy to use, both for the doctors and also for the patients. There are a few places where it's being used already and it's had really good feedback, both from the doctors, nurses and patients.
So what can patients expect to happen now?
So what will happen is patients will receive a message that might be through either a text message or an email with a link that they click on and follow, and that will then take them to a questionnaire that they need to fill out. That questionnaire will then be reviewed by one of our team, maybe one of the nurses or one of the doctors, and then the patient will get a response to say that their long-term condition review has been assessed. It might be that it can be completed straight away, or it might be that they then need to come down for some blood tests or further investigations.
So what are the advantages of the new system?
Okay, so it allows us to gather information on people who have sometimes been difficult to get down for their annual reviews, such as asthmatics who are often a bit younger perhaps in working age or at school and have found it difficult to come down for their annual review in the past, so that can now be done remotely. It also allows us to gather information on the particular condition and then signpost patients to useful information and links such as videos for inhaler techniques and lifestyle information for managing diabetes and blood pressure and things like that. And also we can get really useful information very easily on things like up-to-date weights, blood pressure, smoking status, etc.
So surely you can't do everything remotely. What happens there?
Yeah, sure. A lot of annual reviews do require a blood test. So obviously if you have diabetes, you'll need an annual blood test. Most people with high blood pressure will need an annual blood test as well. So once we've done as much as we can remotely, then you'll probably be told that you need to come down for a blood test with one of our healthcare assistants. Also, a lot of annual reviews require blood pressure to be checked. Previously, people just used to come down to see one of the nursing team to have a blood pressure check, but now we know the gold standard is really to have a series of blood pressures checked at home, so we get more of an accurate picture of what patient's blood pressure really is, rather than just when they attend to the surgery.
And what if patients aren't managing their conditions and are feeling unwell?
So it is just an annual long-term condition review. So if in between the annual reviews people feel unwell, then we ask people when they can to use the technology and complete an e-consultation, or if they can't do an e-consultation, to ring reception and they'll take you through a series of triage questions. Or if you're unsure and feel more unwell, then we'd encourage patients to call 111.
And when will patients hear back from their doctor or nurse?
So probably within a few days of having had their questionnaire and then their bloods or blood pressure checked, they'll then receive acknowledgement that they've had their annual review, and it may be that everything can be signed off for another year. It may be that perhaps the blood pressure is too high or blood tests are out of range, and they then need to maybe have a telephone call with their doctor or one of the nurse specialists perhaps. Perhaps they might need to come down for a face-to-face appointment following their annual review.
And not all patients have access to a mobile phone or email. What happens for those people?
Yeah, of course, obviously more and more people do now, so if they're watching this video, it probably means that they've got internet access, and by far and away the majority of our patients do now and have been using these kind of technologies for the past few months and longer. We've had really good feedback from patients who have embraced the technology. Obviously there are some people who don't have internet or can't use it quite as well as others, and so obviously in that situation we'll still do things the old-fashioned way, get people down and write letters to them when we need to.